And another woman that is incredible. She has taken the ball by the horn and decided to really change her life and her family's life. And Glynnis is from Vancouver Island. Glynnis, I would love you to share your journey. It hasn't been easy. Lots of health issues along the way that really could have made you quit, but you knew what you had in your hands. So everyone, please welcome Glynnis Schwan from the Vancouver Island.
Thank you, Deb and Angela. Wow, that's amazing. I'm so thrilled for you. And yeah, I'm so grateful to be here with everyone. And I live in Nanaimo on Vancouver Island. And I've always been active my whole life. And for me, in my early 30s, I was diagnosed with hypothyroidism. And it was a struggle, but I was able to manage it with medication, and I was able to carry on and, hit the gym. I boxed for 10 years, high intensity interval training, strength training, hiking, you name it, I did it. And it was all going fine all the way up through, my 30s into my 40s. And then something changed. I was moving my body, I was eating well, but my thyroid would tend to fail, and then we'd readjust medication and try to balance it out. And what ended up happening in my 50s is we hit the pandemic, and I knew something was going on. My job was extremely stressful in healthcare through the pandemic, and it was constant cortisol surging. And I wasn't sleeping. I had, come into perimenopause. So I knew something was wrong. I was just trying to figure out what I could possibly do to get well again. So I started my journey. I had all my hormone panel tested. It was thousands of dollars to have the doctor read them to me and ask me how I'm even functioning, because my cortisol was so elevated the moment I woke up, and it was crashed by 11, and I barely could get through the afternoon. And so what I would do is I'd hack and I'd go to the gym to get adrenaline rush. So I became in this big loop, and I flipped my circadian rhythm completely opposite. So I wouldn't sleep, no deep or REM sleep at all. It was all light sleep. I'd hit snooze so many times. Well, we all know that if you don't sleep, that doesn't help your body heal. So I was struggling, and come July of 2022, I was hiking at a high elevation with my husband, and I had to stop because I had this massive pain in my diaphragm through to my spine. And it kind of took me off guard because I hike, and I thought, well, maybe it's because of the high elevation, or maybe I'm having a muscle spasm. So back down the mountain we went, and it went away. So that was fine. But then I started to notice through August and September of that year that when I exercised, I'd have this pain. And then I started to notice through the fall that when I sat at my desk, I had this pain. And every night my stomach and abdomen would be distended, and I'd have a rock hard lump in my diaphragm pushing into my spine. And it actually scared me enough that I went to the doctor. And at the same time, a lovely friend, I don't know if she's here tonight, Colleen, shared about a fatty liver syndrome. And I wondered about that. I wondered if my liver was inflamed. So when I went to the doctor, she ran my blood work, and my cholesterol was up a bit and my blood sugar was up. And she sent me to the hospital. I had scans, all came back negative. And when I saw her, she said, you have to lose weight. Like, that's just the way it is. And I'm like, but I eat well, I move my body, like, okay, like I'm doing all these things. I've turned my sleep around. I do mindfulness. I'm doing breath work. I'm doing all this stuff. And come March, Debbie, thank you so much for sharing what the beautiful Australian gals were doing. We're doing this challenge that involved these drops. And so I jumped on board. That was March, and, away I went, and September rolled around. I've lost 26 pounds. I've lost 35 inches. I actually have a waist again. I'm energetic. I feel like I have a glow. And my doctor is just like jaw drop. She's like, what are you doing? And I shared with her what I'm doing. And she said, this is amazing for people who have thyroid issues. She would highly recommend you would always do the drops if you have thyroid issues, because they support the thyroid so much. It's like massive nutrition for the thyroid. My blood work came back mid-September and my blood sugar is down, back well within the normal range. My cholesterol is almost within the normal range. And she said, I have to give myself time. But she's like, keep doing what you're doing. And she said, if what you have to do is tell the world about this, then you need to do it, because this will help thousands and millions of people. So I'm just super grateful. Yesterday I was on my trampoline jumping for joy, because it's just such a thrilling feeling to feel well.
Glynnis, you looked like you were 7 years old. Do you mind sharing your age?
I'm 56.
56, and on her Facebook, on the trampoline, she's doing flips. And it just made my heart sing, because, it's not all about looking great in our clothes. It's fun. It's not all about just being slim. It's about that health and being able to be with your grandchildren and all the people in your family, and being able to kneel down and being able to be healthy, and to be able to be at their grads, and to be at their weddings, and to be at they're having children. So this is amazing what these products do. And those of you that don't have a lot of weight, be preventative. Dr. Ginger and Dr. Crystal put people on the drops, even if they have no weight to lose, because it resets everything. So Glynnis, that was awesome. Everybody share your love, because